Hi. My signature assignment was on river blindness. A little bit of history of river blindness. It's also called onchocerciasis. It originated in Africa and eventually spread throughout the world through the slave trade. It is the second leading infectious cause of blindness in the world after trachoma. The parasite that does cause river blindness only resides in humans, which makes it kind of hard to eradicate the disease completely. It gets the name river blindness because the flies that transmit the disease are normally found near fast-flowing rivers. Onchocerciasis is caused by the worm Onchocerca volvulus, and it's transmitted through the bites of infected flies. So the way the life cycle works is an infected fly will bite a human, and then that human, once they get bit, the larvae goes into their skin, and then in the skin, the larvae grows into adults, where the adults can actually reside in the subcutaneous tissue for about like 15 years. And then once in the subcutaneous tissue, the female worms produce the microfilariae that can be found in the peripheral blood, the urine, sputum, but mainly in the skin and the lymphatics of the connective tissue. The life cycle continues when another black fly will come and bite that human that's already infected. And so they ingest the microfilariae by biting the humans, and then they go, they grow the larvae in their stomach, and then once it gets to this third stage, they can continue to infect someone else. And here you kind of have the life cycle. So the female worms can grow up to about 50 centimeters in length, and the males are a little bit smaller and grow up to about 42 millimeters. The females are the only ones that produce the microphyllae, and they can produce it for about 9 years. Let's see. So it is transmitted through the infected black fly. They reinfect others through bites. They typically breed near fast-flowing rivers, which is why, again, it's called river blindness. And typically only people that live around that area get infected. The disease can only spread through the vector. So a lot of prevention techniques are aimed at killing the larvae of the black fly. There have been a few public health campaigns that aim at either eliminating or controlling the parasite. So a couple of these will mass distribute ivermectin. I don't know if I'm pronouncing that right. And it's delivered either once or twice a year. There was a program in West Africa in the 1970s that was able to achieve vector control through weekly spraying of insecticides over fast-flowing rivers, but it took over 14 years to break the cycle with a combination of the aerial spraying and the ivermectin treatment. So some symptoms include severe itching and skin changes. This is caused by the inflammatory response that is triggered by the death of the microphyllae in the skin. Other symptoms include eye lesions, which you see here, and it can lead to visual impairment, blindness, if left untreated. This one shows skin atrophy and dryness. This is a subcutaneous nodule that happens after the human gets bit, and this is blindness that happens. The blindness is the most severe consequence of onchocerciasis. So to diagnose river blindness, there's a few options. You can do the skin snip biopsy, which is the commonly preferred method. So you basically just get a piece of skin and you incubate it, and you allow the microfilariae to emerge. And then once they emerge, you can identify it through a microscope and see if that's actually the parasite causing the infection. The treatment of choice is ivermectin, which has shown to reduce the occurrence of blindness and severity of skin symptoms. It's given every 6 years for the lifespan of the adult worms, or for as long as the infected person has symptoms. And side effects of giving ivermectin or taking ivermectin is joint pain, tender, swollen lymph nodes, eye swelling, redness, pain, weakness, vision changes, itching, rash, and fever. Onchocerciasis is mainly only found in tropical areas. More than 99% of people that are infected do live in sub-Saharan Africa, and there's a small percentage that is found in the Yanomami area of Brazil and Venezuela, as well as Yemen. There have been no new cases of the disease in the Americas since 1995, and there's currently no AI models for diagnosing or treatment of river blindness. There's proposal for research studies, but nothing that's actually in use. And that's it.